My name is Dr. Melinda Rathkopf. I'm a pediatric allergist immunologist at Emory University and Children's Healthcare of Atlanta. I'm here today representing the Medical Association of Atlanta. Last May, the association formed a task force with a goal of advancing evidence-based policies that improve social determinants of health and result in improvement of the health outcomes and economic well-being of Atlantans. This webinar is part of a series that will touch on how physicians and the healthcare system can help influence housing, transportation, and food insecurity in Atlanta. I'm here today with Matthew Pieper, Chief Executive Officer of Open Hand Atlanta, and Aleta McLean, the Senior Director of Client Services and Outcomes Tracking. We will speak today about what is being done in Atlanta through Open Hand Atlanta to tackle food insecurity issues, touching on reliability, safe access, and more. Our goal today is to discuss how physicians can help move this work forward. Matthew and Aleta, thank you for being here with us today. Can you please introduce us to you and share a bit of your background?
Great. Hi, Dr. Rathkopf. Glad to be with you today. As you say, I'm the Chief Executive Officer of Open Hand. We are a medically tailored meal provider serving Metro Atlanta and many parts of Georgia. I've been proud to be affiliated with Open Hand for 17 years now. I'm also the advisory board chair for the National Food is Medicine Coalition, which are medically tailored meal providers across the country, all working together to integrate our nutrition services into healthcare.
Thank you. Aleta?
Yes, and I'm Aleta McLean. I currently been with Open Hand for over 21 years. I oversee our client services team that is responsible for enrolling clients into services and making sure they're satisfied. And I also oversee our programmatic team, which consists of our community registered dietitian nutritionists and nutrition educators who go out in the community to teach our evidence-based programs. Our partnership manager, evaluation manager, and just making sure we are overseeing our government contracts and in collaboration with Matt, oversee our policy initiatives.
Well, thank you for that introduction, and thank you both for joining us today. So let's start by talking about Open Hand Atlanta. Can you speak generally about the type of work that you do and what drew you both to this work?
Yeah, be happy to. So Open Hand is the largest community-based provider of home-delivered meals and nutrition counseling in the Southeast, and one of the largest in the country. And everything we do here at Open Hand is done through the food is medicine lens. So the meals that we cook here on campus in our Midtown location are made from scratch every day in our kitchen. Very few preservatives, very few canned goods, because canned goods oftentimes have too much sodium. These are really healthy meals that typically meet or exceed the nutritional standards set by the American Diabetes Association, the American Heart Association, the USDA, just to name a few. And we are accredited by the National Food is Medicine Coalition for the work that we do here. It's not only the made from scratch meals that are the core of what we do, but it's also our commitment to nutrition education and counseling. And so we do employ 8 registered dietitians who are going out into the community, oftentimes to help people understand the connection between good health outcomes and healthy food, right? And so in addition to our prepared meals made in our kitchen, we also do healthy groceries. So we call them market baskets. And for able-bodied individuals who are able to prepare meals for themselves, we're providing them with healthy ingredients to supplement their diet. So we're not a typical traditional Meals on Wheels organization. It's a higher level of nutrition and a bigger commitment to integrating our services actually into healthcare, and not just as a means to address food insecurity, but we like to say to address nutrition insecurity, right? It's a bigger conversation than just hunger, although many of our clients are living below the poverty level. And what
What
drew
an
me to
interesting,
work? Yeah.
yeah.
You know, I love our mission because it's very solution oriented. And throughout my career, I've been connected with several health organizations. And I love the fact that through the right kind of nutrition, we can help people live a better quality of life, but there's also a fiscal outcome to what we do. If we can keep people out of emergency rooms and prevent them from being readmitted into a hospital after they've been discharged, then we can save our country and our healthcare system a lot of money, right? And so I love that we're helping people live a better quality of life, but I also like that we are helping to sustain our healthcare system.
Love that thought about nutrition insecurity. It's not just about food insecurity because you may have access to some food, but is it the right food? Is it the healthiest food for you? And is it, what you need? And do you have that knowledge? So that's great. Aleta, would you like to add what drew you into this and any additional information about Open Hand Atlanta?
Yeah, I will say Open Hand is also very volunteer driven. We have a huge volunteer base that helps us fulfill our mission. And I actually started as a volunteer before coming to Open Hand and fell in love with the mission. But our mission is very purpose filled. So when we think about the work that happens, there's food banks and there's other community-based agencies that again will pass out food. But again, to Matt's point, Open Hand is trying to help people prevent or better manage their chronic condition. So as a background as in community health education, that stuck with me in terms of when I was volunteering. And I always say, if not us, then who?
Thank you.
Dr. Rathkopf, I might just add that one of the things I love about our mission is that we do serve both sides of the socioeconomic spectrum. So we actually sell our meal plans to the paying public under the Good Measure Meal brand. And 100% of the net proceeds go back to support the work that we're doing in the community. So for every two Good Measure meals that we sell, we can provide enough funding to provide a meal to someone who doesn't have the means to pay. So it's that strategy of serving both sides of the socioeconomic spectrum because frankly, everyone needs access to healthy nutrition.
What an interesting concept, because then too, it's a way of fundraising and a way someone can give back who may not find the time right now to volunteer, but just by using your meal services, they're also giving back to your mission and to your cause.
Absolutely. Absolutely.
So you're providing these home delivered meals and groceries and nutrition services. You started to talk about it, but can you go a little more into your customer base and Aleta, then maybe also some of the data points behind who you're treating and kind of what you're tracking there?
Yeah, absolutely. And as Matt mentioned, we do service the entire socioeconomic spectrum with our meals. But the majority of our clients live under the federal poverty level. I would say about 72% of them. Over half of them are over the age of 60, and probably about 80% of them are experiencing food insecurity when they come to us. We serve the majority female clients, and I would say probably over 80% of them are minority clients as well. Our clients come through to us through mostly for our medically tailored meals, coming with all different types of conditions, mostly though the nutrition sensitive chronic conditions, hypertension, diabetes, kidney disease. We started off as an HIV and AIDS organization, so we still serve a good amount of people who are now living longer with HIV, so they have comorbidities, stroke, chronic congestive heart failure, and just other conditions. So we're serving individuals with a vast majority of conditions.
And can
Um,
you touch on some of the research that speaks to the impact of your work and also a little bit about payment and options that are available to Georgians?
Yeah, absolutely. So there has been significant research done in the field. As Matt mentioned, we are a part of a nationally accredited food as medicine coalition, and some of our coalition partners have published research that talks about the impact of medically tailored meals and the cost savings. There's a report in done by Tufts University that where that has focused on cost savings, where individuals who participated in the medically tailored meal program, there was a healthcare cost savings of $23.7 billion dollars overall and 2.6 million hospitalizations prevented. And that's looking at across over a year's time in over 49 states and looking at the cost savings of the medically tailored meals. But although Open Hand hasn't published any research, we still have evaluated our data and done pilot projects and where we saw cost savings as well. We completed a pilot with Grady Hospital where we provided discharge meals to patients being released from the hospital that were experiencing food insecurity. And there was a cost savings of approximately $6,000 per patient when
Wow.
looking at the cost of care, 30 days pre-enrollment and then 30 days following the enrollment of the program. And out of the 550 patients that were enrolled, only 56 were readmitted back to the hospital. So we're definitely looking at showing hospital systems that they can decrease their readmissions through collaborating with medically tailored meal providers. And we're looking at other factors as well, such as convenience, being delivered a home delivered meal after being discharged and you're week from the hospital, removing worry about where you're going to get your next meal, reduce caretaker burden, and our meals themselves just illustrate healthy eating for those with nutrition sensitive chronic conditions and those that are newly discharged from the hospital.
I might
That's some great data. Yeah, go ahead.
add that there's also a wonderful study that was done by the University of California at San Francisco. Dr. Sherry Weiser was the principal investigator, and they worked in collaboration with one of our sister organizations, Project Open Hand in San Francisco, to provide 6 months worth of medically tailored meals to several cohorts. One cohort were individuals who had diabetes, uncontrolled diabetes, another cohort were people living with HIV, and then there was another cohort of individuals with comorbidities, right? And so they compared the results to medical claim records, and that result truly did show a significant reduction in hospital readmissions and in healthcare expenditures, so much so that it led the state of California to launch a pilot that is ongoing now where Medi-Cal, which is California's Medicaid system, is actually providing medically tailored meals as a reimbursable benefit for certain disease conditions for citizens in California. And that is actually a trend. That is, there are a number of states now whose Medicaid programs are actually providing medically tailored meals and nutrition counseling as a reimbursable benefit. And that's our hope and goal for Georgia as well.
I was going
Yeah.
to ask, are we doing that yet in Georgia, or has there been any legislation that you know of working on that yet?
We're very pleased that Georgia's Medicaid program uh, did allow for Medicaid plans to begin offering medically tailored meals as a benefit, not reimbursed yet by Medicaid, but at least the plans can offer medically tailored meals. And that was partly inspired by the White House Conference on Nutrition, Health, and Hunger about 3 or 4 years ago, which led many states to begin offering medically tailored meals. Unfortunately, those plans and that opportunity is tied up in litigation right now. So once the litigation is resolved, we're very hopeful that Open Hand will be the preferred provider of medically tailored meals for those 4 Medicaid plans in the state of Georgia. And so I think we're heading in a good direction there.
Good
And
to hear.
I will add on to that, Medicare Advantage plans
Okay.
currently do have some short-term offerings, for like discharge meals for up to maybe 12 weeks and those with kidney failure. So there are some Medicare plans that will offer a short-term benefit. But also in Georgia, the Medicaid plan, Medicaid has an elderly and disabled waiver. So persons who qualify for meals through the elderly and disabled waiver can receive home delivered medically tailored meals. And we are a Medicaid waiver provider for the Georgia Medicaid waiver program. But other than that, there is definitely a gap in those individuals who need medically tailored meals and the options to receive them.
So what are the options right now for Georgians? So if they don't fall under that Medicare Advantage or one of those waivers for your clients that are in those other groups, how are they coming to you and the payment options that are available?
So currently, well, we are a provider for some of the senior meal programs throughout the state. And like I said, we started off as an AIDS service organization. So individuals who have HIV or AIDS were able to provide meals through them through Ryan White or HOPWA funding. But then after that, there's the gap unless they can pay for meals out of pocket. We do, as an agency, raise funds philanthropically where we will identify corporations and foundations that will cover some of the cost of meals, but there isn't a true sustainable method of covering medically tailored meals without us having to identify funding or through those small categories of designated funding.
What would you say are the biggest issues facing Open Hand Atlanta, generally in Atlanta? I imagine this is going to be one of them. And how are you working to address these?
Yeah, it's sadly it's the economy, right? So food inflation, fuel prices, which have dramatically spiked just in recent weeks, as pretty much our entire country is aware of. We're our food bill, we're one of the largest food providers in Georgia, frankly. And so I can share with you all that our food prices, we're paying 40% more than we were 4 years ago, right? And that is difficult to sustain. Fuel prices, labor prices, just the affordability to live in Metro Atlanta. And so many of our, hourly paid employees or oftentimes are coming from outside of Atlanta just because Atlanta has increasingly become a more expensive place to live with apartment rents and mortgages and so keeping pace with inflation has certainly been a challenge. And then coupled with the threats of federal funding. So one of our federal funders is SNAP Education, and that helps to fund cooking classes that we provide clients, frankly, throughout the state of Georgia. And these cooking classes are very practical. We're not only handing out recipes and teaching people how to prepare in a health food in a healthy manner, but we're taking people on virtual grocery store tours and teaching them which aisles they should shop on and which ones they should avoid. We're teaching people how to read a nutrition label. If it says it's low sodium or low fat, how do you know? We're teaching people how to prepare a food budget and manage a food budget and how to feed a family of four on limited resources. Um, and sadly, that funding stream is going to be cut as of October of this year. And so, when you've got this incredible inflation coupled with federal funds that are being threatened, it impacts sustainability, which is part of the reason why we're very excited about new payers coming into the marketplace through managed care and health plans. Um, and also why it is that we spend a lot of our efforts and time doing advocacy up on the Hill in DC or down at the state capitol, right? To help do the math equation and help policy makers understand that if we'll spend a little bit more on the right kind of nutrition, we can save our taxpayers and our healthcare system major significant dollars by keeping people out of institutionalized care and living in their home where typically people want to live for as long as they can. So yeah, the keeping pace with inflation is a big challenge. We're grateful to have a large donor base at Open Hand and many generous individuals and companies that believe in our approach to nutrition and who are willing to make donations to our organizations to help with that gap between what government agencies will pay us versus what the true cost is to provide, to cook up and package up and deliver truly medically tailored meals. Because what we do here is more expensive. Like everything we're using is grade A chicken, grade A beef. It is quality food in addition to high nutrition standards, and frankly, that costs more, right? And so keeping pace, I think, with inflation is definitely a big challenge right now.
And, of course, your home delivery requires transportation and keeping food fresh. Can you talk a little bit more about the work that goes into those components? You already mentioned fuel prices, but
Yeah.
just the logistics of all of that.
Yeah, absolutely. So we are fortunate that we have a fleet of refrigerated vehicles, right? Because food safety is absolutely critical in any setting, but especially when you're serving people who may have compromised immune systems or who are medically fragile, right? And so making sure that the food is safely delivered. We do temperature testing. We shorten the delivery routes so that no food is out there on the road for too long before it's actually delivered. We specialize in frozen meals. And so for meals that we're shipping beyond our delivery geographic area, we ship those in dry ice to ensure the freshness and also the safety. The wonderful thing about frozen meals is that frozen meals actually lock in the nutrition better than other types of hot meals, right? And so it used to be that the standard sort of in the Meals on Wheels environment were hot meals, but hot meals can sometimes form pathogens. And in particular, if you're delivering to a homebound senior, understandably, that senior wants to eat that meal when they're ready to eat that meal. And if that meal ends up sitting around in the kitchen, that can promote germ growth. And so with the beauty of frozen meals is you eat it when you're ready and you just pop it into the microwave and 4 minutes later, you've got a freshly prepared hot meal. So the logistics behind what we do, recognizing that we deliver meals as far south as Macon, Georgia, and we're up in the mountains of North Georgia. So we're not just Metro Atlanta anymore. And it does take an entire fleet of vehicles to cover our geographic area. But we're also blessed to have hundreds and hundreds of volunteers who also help to deliver meals in the local area here. And they're using their own cars and their own fuel, which is, of course, a wonderful
Nice.
savings for us. And we are a very volunteer-centric organization, as Aleta had pointed out. And we're grateful that we're inviting the community in to be part of our mission delivery, right? And to me, that's about community impact and frankly, community activism, right? I love that we have so many wonderful volunteers who really understand our value proposition for medically tailored meals and nutrition counseling.
Thank you. And of course, as an allergist, I have to ask, how do you handle allergies and other dietary restrictions?
Yeah, so our meals are designed by a registered dietitian. So one of our dietitians that we have focus solely on menu development, and that's where the dietary restriction piece comes into place. So they're looking at standards from all over American Heart Association, Diabetes Association, the healthy adult for, I think we're on 2026 now. So we're looking at all those guidelines. But one of the good things that Open Hand has done with our meals is that we've combined our standards so that a person doesn't have to decide on whether or not to get a heart healthy meal or a diabetic friendly meal. All of our meals are designed to meet multiple chronic conditions. So if you're suffering from comorbidities, our healthy, balanced meal will meet the requirements for that. We do consider some allergies. We're not able to consider all since we don't have a separate kitchen. But if they have allergies, they can let us know. And we also look at some sensitivities. So if they can't have like beef or pork, or if they're vegetarian or vegan, we're able to sub for that. And once we put in those allergens into our system, they are only able to see the meals that do not have that option for them.
Okay, so they can filter when they go to choose their meals, they can filter them by their dietary restrictions and their allergies.
Yes.
Nice.
And we're really proud of the amount of choice that we provide. It's something that we've invested quite a bit in from an operational perspective. We have a custom designed ordering system that typically allows someone to choose from two other meal types if they have a personal preference against one of the other meals we're providing, right? And so to us, that's about dignity and really giving people, trying to meet their personal preferences on taste, while also meeting their medical needs through our medically tailored meals. So a lot of choice out there.
Nice. How do you reach populations that may not be comfortable coming in person to see a physician, or can you talk maybe about technology that you have available?
Yeah, absolutely. So for our meal service, all of it is home delivered. So they would not have to, clients do never have to come to pick up meals to receive services from Open Hand. We're trying to reduce that barrier in itself, since most of our clients are maybe medically fragile. So we're delivering those meals, but we also have a telehealth platform for our
Okay.
registered dietitians. So even though most of our community-based classes or our nutrition education classes are in person, we do offer a lot of those classes and our nutrition consults via telehealth. So we use a platform called Healthy, and our registered dietitians can set up virtual diabetes self-management classes, chronic disease self-management classes, do one-on-one medical nutrition therapy, and even some of our cooking classes all can be done virtually.
Nice. So these nutrition services are so important. What is kind of the flow, like I as a physician or other medical provider and the patient, as far as designating an individual who might need some of those services and then how they, can receive them?
Yeah, absolutely. So, going through the process, our referral is received for our medically tailored meals. Our client services staff are doing the general screening to see which program they best qualify for. But one of the things about our intake process, we're looking at food insecurity and nutrition risk, but we're also doing a nutrition risk screening to
Okay.
determine the level of nutrition intervention they should receive. So it will determine the number of meals they receive sometimes, but also that interaction with our registered dietitian to make it a fully medically tailored meal intervention. So depending on their nutrition risk, they may receive a one-on-one consult for those that need more intensive hand holding through their process. They may qualify, those at medium risk can participate in some of our virtual classes or in-person classes to get some additional support. And if they're at low risk, then we may just provide them with nutrition education flyers and handouts and let them know that at any point in time that they can reach out to us to speak to one of our registered dietitians.
So I, as a physician, don't have to try to figure out if my patient qualifies for your services. We could send the referral and you have a team that would do the screening, give them their options, see if they qualify for any of the programs. And it could be intensive or it could be lower risk individual. And you can help
Absolutely.
us.
Yeah.
Okay. You could take off a lot of that work from our end.
Yes.
And if they don't qualify for one of the funding streams that will support medically tailored meals, we do, of course, have fee for service. So with our Good Measure Meals, we do serve many patients and many clients who have the means to pay and really are looking for truly medically tailored nutrition. So there's no one in the state of Georgia, and I say this with great pride, not with arrogance, that is producing medically tailored meals to the nutritional level that we offer here at Open Hand. And we truly are committed to being the preferred provider of medically tailored meals for the state of Georgia.
What are some of the current roadblocks or gaps that kind of hinder the process from running as smoothly?
Yeah, well, we mentioned the economy,
Yeah.
right? But I'll also say that scale is a challenge. As we scale up our services beyond just Metro Atlanta, it means that we are increasingly serving an even more diverse patient population, right? And so that has operational consequences because we really are committed to trying to meet people's cultural preferences as for in the meals that we offer. But as we grow and our geographic reach, that increasingly becomes more challenging, right? To try and meet everybody's needs. Food is there's a lot of personal preferences that go into food, right? And what satisfies 100 people might not satisfy 100 others, right? And so trying to meet people's personal preferences and their cultural backgrounds as we scale up will always be an ongoing challenge.
Yeah.
Is
I'll
that part of
also
your,
add, I'm sorry.
yeah, I was just gonna, is that part of kind of the filtering where you can choose choices, where you could put in a particular cultural meal style, or is it
Yes.
more based on individual? It is. Okay.
Yeah.
Thank you. Alita, go ahead. I'm sorry. Didn't mean to cut you off.
No. I'll also add that one of the gaps is determining eligibility for clients and whom we can serve, because determining on the funding, it kind of dictates the number of meals we can provide a
Mm.
person and actually who we can serve. So sometimes that is a struggle because you have to kind of filter through who it is that you can provide the medically tailored meals to, even though they may definitely on paper qualify for the service.
And, talking about the other social determinants of health that our task force is looking at, do you see an impact from housing and transportation insecurities in your work?
Yeah, I will say from a housing perspective, that definitely impacts our work because our work is it is home delivered. So the housing insecure population, if they don't have a place to properly store the meals or heat our medically tailored meals, it makes it difficult for us to provide them with the appropriate nutrition and intervention that we would love to. There are instances where we can provide them shelf-stable meals, but again, that's not our medically tailored meal option that we would like to be able to provide to that population.
I would add that because we are a home delivered meal service, we're actually helping to address transportation barriers, right? And so in particular for homebound seniors who are not well enough to go grocery shopping, right? We're a really vital resource, and for adults of all ages who may be homebound or who may be battling serious chronic health conditions. I often think about our clients who are diagnosed with cancer, and we have many cancer patients who take advantage of our medically tailored meals. And of course, it's a very intimidating and very stressful diagnosis to receive, from your physician that you have cancer, and you oftentimes are instructed, and rightly so, that you're going to need to revamp your entire diet. Well, that's very intimidating, and frankly, most people fail coming out of the gate. But that's where our registered dietitians really come into play, because we're going to surround that patient with a lot of information and do the cooking for them, right? We're going to provide them the nutrition that they need so that they don't have to think so much about that. They can focus on other ways to get better, but we want to handle their nutrition for them. And there's a lot of science that goes into planning the menus for the food that we offer. And so, yeah, I do feel like, our nutrition services is actually helping to address transportation barriers.
Good point. And obviously, as the Medical Association of Atlanta, we work a lot at the local and state level. And actually, I just went to Capitol Hill with Medical Association of Atlanta members and Medical Association of Georgia members. But what has your experience been like working with city officials and groups to tackle some of these challenges you're seeing? And are you getting some traction on this local level?
Absolutely. Both Aleta and I focus a lot of our time in working with legislators and policymakers from around the state. Senator Ossoff, Senator Warnock have been especially supportive, but we also have worked with legislators from Savannah and Valdosta, oftentimes asking them to write editorials and try to get those published about the importance of our services, and in hopes to protect the federal funding streams that exist, but also to create new ones, right? And so we are up on the Hill in Washington, D.C., typically with other community-based agencies, and certainly with our partners in the National Food as Medicine Coalition. We love delivering meals with legislators and policymakers, right? And so they get to see firsthand, the impact of what we do. Or we'll ask legislators to come sit in one of our nutrition education classes or our cooking classes, so that they really understand our value proposition and our approach to nutrition services. We are so grateful to legislators like Nikema Williams, and so many others who from both sides of the aisle. And that's really important too. It's really important to have friends on both sides of the aisle, because really our nutrition services should be viewed as bipartisan, right? I don't know of any legislator who wants to see people go hungry, or who wouldn't like to keep people out of the hospital if they can. Right? And so engaging policymakers, all of our Fulton County commissioners, all of our City of Atlanta commissioners, all have come to volunteer with us. They frequently hold meetings on our campus. We actually had recently the entire Fulton County delegation, chaired by Chairman Rob Pitts from the Fulton County Commission, who met for a reception on our campus recently. So can't say enough about the importance of legislators and engaging them in our work. And thrilled that we feel like we're getting more response than ever before. 10 years ago, no one ever heard of a medically tailored meal practically, right? But now it's much more part of the national dialogue, and certainly the public health dialogue. And that's very encouraging to me. Even in these politically charged times, I feel like there's a lot of momentum that is building and that is ongoing as our country understands the value proposition of feeding people with healthier nutrition.
Can you tell us a little bit more about the Food as Medicine Summit that you mentioned?
Gladly. We were so proud to have launched our inaugural Georgia Food as Medicine Summit back in November. And we did this in collaboration with Emory Healthcare, a wonderful partner. And we invited primarily medical providers and case managers and individuals involved in population health management. It was the audience intentionally was a medical audience because we wanted to share data around the value proposition of medically tailored meals. So Aleta referenced the study that Tufts School of Nutrition did, and we brought in the principal investigator to really share the data from that study, as well as looked at the study that I referenced that was done by Project Open Hand San Francisco and University of California, which, by the way, was published in a peer-reviewed journal, the Journal of Urban Health. But we really looked at the data and we looked at innovation in community settings, right? And regarding medically tailored meals, but also food access in general, right? And so, as an example, we focused a lot on produce prescription, where we're providing boxes of fruits and vegetables, but then also wrapping around our cooking classes in addition, in order to get people from an uncontrolled state of diabetes into a controlled state, and really looking at some of the significant research data out there. So we really had no seats left. I mean, the response was phenomenal, and we intend to repeat this again this year in collaboration with Emory Healthcare. In fact, we're looking at a couple of dates in October that will, as soon as we have one solidified, we'll certainly share those and publish that. We're going to need a bigger venue because the interest was palatable. I will also mention that we had a researcher who really talked about the connection between eye health, diabetes, and dementia. And you could have heard a pin drop. People were enthralled with the data that she was showing and really helping to draw the connection between diabetes and dementia, sadly. And it is increasingly becoming a focus, I think, for our public health system. I know at the Food as Medicine Coalition, we're very interested in doing more research around the impact of nutrition on dementia. Just as we're very interested in working with more women who have gestational diabetes. Georgia sadly has a really high infant mortality rate. We'd like to better understand what would happen if we were to integrate medically tailored meals into high-risk pregnancies. And in fact, we just recently launched a pilot in collaboration with CareSource, specifically looking at women with high-risk pregnancies. And it's a small study, but I think it's a good start. And that's just one of the areas where we'd like to see more research data.
It's fascinating. I was at an AI summit meeting that Dr. Eric Topol was the keynote, and talking about how just from a retinal scan, you can determine the risk of Alzheimer's, the risk of diabetes, the risk of cancer can be predicted just from scanning someone's retina.
Yeah, wow.
Yeah, it's fascinating. So the Medical Association of Atlanta is interested in this conversation of exploring this connection between food, wellness, and how physicians fit into this picture. As a group of physicians that are interested in advocacy work, how can we help Open Hand Atlanta advance your goal?
We frequently will ask, in particular, the medical community to reach out to elected officials and to advocate for the protection of federal funding streams like the Older Americans Act or the Ryan White Act, or Medicaid waivers, but also to encourage new funding streams, right? And so that's one way. There is a bill a medically tailored meal bill pilot that was introduced by Congressman Jim McGovern out of Massachusetts that we are currently working with legislators from both sides of the aisle to hopefully get that bill passed. If it was passed, it will do continued research on what would the economic impact be on traditional Medicare if Medicare was to provide medically tailored meals as a reimbursable benefit. Medicare doesn't presently provide funding for food, right? And so we're hopeful that this bill will pass. If it does, it means that there would be congressional dollars to work with several different hospital systems across the country. I'm very hopeful that Atlanta will be included in that if it's passed. And we would love support from legislators in and the medical community in supporting that medically tailored meal bill pilot. And then there's just, so many wonderful physicians and clinicians have relationships with insurance plans and managed care. We would love for you all to advocate with those health plans and managed care organizations to include medically tailored meals as a benefit, and to understand the math equation that if we can keep people out of hospitals and keep them out of institutionalized care, we can actually save those managed care and health plan organizations a lot of money. And so that's just some of the ways I think that the medical community can help advocate for our services. Aleta, anything you would add to that?
And maybe also advocating for more dollars along research,
Yeah,
because research is what's going to get us showing that return on investment.
yeah. Well said.
Yeah, I think definitely, maybe finding some medical students or residents that are looking for research opportunity. And
Hmm.
so many coming in now are more conscious of the public health and of the social determinants of health. So we might be able to help you out there. And please forward on to us specific bills. So this one you mentioned out of Massachusetts, it's being
Yes.
looked at, forward us the specific bill numbers and so we can help with that. So, just kind of as we start to close, what does success in Atlanta look like to you? Maybe short term and then longer term success, both realistic and the ideal.
Yeah. Well, research is in the short term, I think can be incredibly helpful to advancing, the food is medicine philosophy, right? And I'm actually very encouraged that we collaborated with the state of Georgia under the state's health commissioner, Dr. Kathleen Toomey, to apply for some funding that has been announced by the Rockefeller Foundation. And it's funding that will be provided to 10 states across the country, and it's $10 million. And the intention is to develop a statewide food as medicine strategy, right? And if the state of Georgia is successful in its application, then we, of course, want to work very closely with our state officials in really developing that food as medicine strategy. So in the short term, that's a big goal, not just for Atlanta, but really for the entire state of Georgia. And not just to look at medically tailored meals, but to look at healthy food access programs in a variety of ways. So the research, I think, in the short term is critical and is my hope that we can do, more work in collaboration with Emory, in collaboration with Morehouse School of Medicine to really validate our value proposition. Long term, I'd love for Open Hand to be the preferred provider of medically tailored meals for the entire state of Georgia, and that anybody in the state who truly needs medically tailored nutrition has access to our services regardless of their ability to pay. That is my long-term vision, right? So, uh,
Wanted to applaud there. So
yeah.
I love it. So, Aleta, do you have anything to add there, or either of you have any kind of closing comments you wanted to be sure we got to as we start to wrap up here?
Yeah, I would say, short term, obviously more healthcare, food system partnerships and making that connection. But long term, kind of going to Matt's point, making sure everyone, the same way that prescriptions are for medications. I would love to see that for medically tailored meals where a physician is saying, okay, this person has this chronic condition, it can benefit from medically tailored meals. I can write this prescription and it's being fulfilled with, funding associated with it so that there's no barrier for a client to get the necessary resources that they need.
So interesting. I have to say, what popped into my head is, again, going back to my pediatric allergy roots, is we are working at the other end of the age spectrum on trying to get, certain foods into the diet of our infants, toddlers to cut down on food allergy. But
Hmm.
for those who have food insecurity, how can we write a prescription for peanut butter?
Right.
How can we get these things into the diet? So same concept, different ends. So across the spectrum, right? Well, I
Yeah.
really want to thank, well, Matt, let me give you a chance for any last minute comments before I wrap up here.
Yeah, I would also applaud the medical community for providing more of a spotlight on the need to screen patients for food insecurity. Grady Hospital has really done a lot of work around in this area. And I'd love to see, legislation and policy that requires the medical community actually to screen, in particular hospital systems to screen for nutrition insecurity, right? And I think that's a really important step as we try to uh, to enroll people into medically tailored meals and to integrate medically tailored meals as a medical intervention, not just as a means to cure hunger. So, yeah.
And that's what got me here working on the task force, actually. Is so in our clinic at Children's Healthcare of Atlanta, we screen all of our patients for food insecurity. And it really woke me up to then what are the resources? If we're asking the question, we need to be able to help.
Yeah.
And so I really want to thank both of you. I want to thank our audience for tuning in. And thank you, Matthew and Aleta, for taking the time to speak on such an important topic. I'm just so in awe of the program y'all put together and what you're doing, and can't wait to get more involved and to go order my meals for myself. So if you're interested in learning more about Open Hand Atlanta, we have placed more information in the show notes. And thank you all for watching.
Thank you for letting us be here today.